OSHA requires that you wear gloves when it is anticipated that your hands will have contact with blood or other potentially infectious materials, mucous membranes, non-intact skin, when performing vascular access procedures, and when handling or touching contaminated surfaces or items. When would this happen? Examples are giving an injection, performing a venipuncture, or cleaning a laboratory countertop that has blood on it. Clean gloves reduce contamination from your hands by 70 to 80%. This helps to protect you and your patients from infection. It's important to change your gloves before and after each patient to prevent cross-contamination or the spread of infection from one patient to next. First, let's look at how to apply clean disposable gloves. Remove your rings and put them in a safe place. Rings can cause tears in your gloves. Sanitize your hands. The warm, dark, moist environment inside of a glove provides ideal growing conditions for microorganisms. Washing your hands or applying a hand rub removes pathogens and prevents their spread. Choose the correct sized glove for your hands. Your gloves should fit snugly, but not be too tight. If your gloves are too small, they may rip as you are applying them or become uncomfortable to wear. If they are too large, you may find it difficult to perform your tasks. There's no special technique for putting on clean disposable gloves. Your hands are clean and your gloves are clean. Pull them on and adjust them to fit. Inspect the gloves for tears. If you see a tear, remove the glove, throw it away, and apply a new one. Once you are finished with your task, you will need to remove your gloves. Used gloves are considered contaminated. It is important to remove them in a way that doesn't contaminate your clean hands. This protects you from being infected with a pathogen. Grasp the outside of one glove about 1 to 2 inches from the top with your other gloved hand. Most people use their right hand to remove their left glove first. But you may start with either glove if there are no visible contaminants on your gloves. However, if one of your gloves has blood or infectious materials on it, you should remove that glove first. Slowly pull the glove off of your hand. It will turn inside out as it is removed. Pull the glove free and scrunch it into a ball in your gloved hand. Place the index and middle finger of your bare hand inside of the remaining glove. Be careful not to touch the outside of the contaminated glove with your bare hand. Pull the glove off. Notice once again it turns inside out as it is removed, enclosing the balled-up glove. Discard both gloves into an appropriate container. If your gloves are visibly contaminated with blood or other potentially infectious materials, they must be discarded in a biohazard waste container. Otherwise, you can discard them in a regular waste container. Sanitize your hands to remove any microorganisms. Wearing clean disposable gloves is an important part of hand hygiene and one of the most effective ways to prevent the spread of infection in the medical office.